bring them up.
Sure, sure. Yeah. First of all, thanks for having me. My name is Mouhamed Ndoye, co-founder and CEO of Tanél Health. As mentioned, I was born and raised in New York City. So in 2020, it was COVID. I had co-founded a Senegalese American professional network, and because it was COVID, we would have weekly meetings just to meet with members across the country. And the common theme was people were worried about their family in Senegal, and the key worry was healthcare. So I thought, why not move to Senegal and start Tanél? And initially, it was in-home primary care. And the idea there was the people in the diaspora would be able to pay for their family's health expenses in Senegal. So I hired a doctor and a nurse, and we would go to people's homes, and the division was in-home primary care. Uh, Very quickly, we realized that we were building a car where roads didn't exist and that there wasn't infrastructure for healthcare. So when it was time to prescribe medication or it was time to send the patient to a specialist, for example, there wasn't infrastructure. So you had to write everything down. A few weeks later, you'd follow up with the patient and they would say, I lost the prescription or I lost the referral. So we started a question and say why not start building the roads before we build the car? So we started to look around and similar, I would say to Gregory, and it's not even because he's here. We looked at the M Pharma model quite a bit and realized that pharmacies were the epicenter of healthcare in Africa, because as Gregory said, when you're sick, you're going to a pharmacy because just in terms of availability. If you look at, for example, the average primary clinic, they're open probably from 10 to 4 in the afternoon, but the pharmacy is open from 8 to 11 at night. So just look at the person who's going to work, they're coming off from work, they're going to the pharmacy. Um, so we decided to build for pharmacies, and the thinking there was build software so that pharmacies can manage themselves, and then we can use that as like the Trojan horse to build across. So we did. We built pharmacy management software, and that's what pharmacies were using to manage their stock, to manage their sales, and everything was in real time. As we were building for that, we realized that there was a huge problem that pharmacies were dealing with, and that was claims. So in insurance, health insurance, it's very much paper based in Africa. So, for example, in Senegal, if you wanted to go to the hospital today and you have health insurance, you would literally have to go to the insurance company's office to get a paper claim, then go to the hospital. So, us having built software for the pharmacy, we thought, why not build for the insurance companies as well? So we did that. First thing we built was to enable them to see the claims that were coming from the pharmacy. So when a pharmacy would make a sale, we would leverage that data and turn it into a claim. So there was no additional work for the pharmacy, and they would be able to see that. As we were building the software for insurance companies, we then would go to insurance companies and present. And we realized that there were two types of insurance companies. Those were the traditional players where they sold insurance, quote unquote, but it's less than 2% of their revenue, so it wasn't really a focus for them. Or you had HMOs, where these are fully focused health insurance companies, but they're very small. So typically they manage less than 1,000 lives, and they're owned by some person that's about to retire in a few years. Um, we need to go present and share our software. And for both of those parties, they would say, well, this is interesting. We really like what you're doing. My co-founder and I would think, oh yeah, tomorrow they're going to sign the contract and we're on our way. We'd call the next day and they'd say, the guy that's supposed to decide is on vacation. Uh, we'd come back a week later and they'd say, you know what, we're still thinking about it. So we sat one day just out of frustration said, why not become an insurance company ourselves? So that's what we did. And we launched Tanél. And today we're a group health insurance company. So we work with employers seeking health insurance for their employees. And it's going well. We're in the informal sector as well as the formal. So for example, there's no visuals, but we recently signed a partnership with Yango. Yango is the largest drive sharing platform in Senegal, in West Africa, for the drivers to get access to health insurance. So it's been a journey. If I were to sum up our entire journey, I think stumbling is the best word. Is that we stumbled into what we're doing today, but yeah, it's been a fun experience.
Fantastic, Mohammed. I think one common theme we see from both is innovators who